All right, let's talk health now. Sickle cell is one of the world's most genetic illnesses, and it is celebrated annually on the 19th of June. Experts seek to raise awareness about the disease and the challenges experienced by patients, their families, and caregivers. The theme for this year is Global Action, Local Impact, empowering communities for effective self-advocacy. Now, joining me to discuss this is Audu. He's the Program Director of Sickle Cell Foundation, Nigeria. Thank you so much for joining us.
Thank you very much for having me.
Right, so I wanted to, this conversation for me is also very personal. It's coming on the back of, just losing someone, who in a community from sickle cell just about a few days ago. And I'm wondering, where are we in terms of being able to maybe ensure that those who suffer this illness or disease do not, have their lives cut short at the prime?
So as a nation, I'll speak from the collective standpoint of the efforts being made by the government and the efforts being made from stakeholders like Sickle Cell Foundation Nigeria. From Sickle Cell Foundation Nigeria, we are really committed to ensuring that we provide comprehensive approach to our solutions, from comprehensive care, prevention, and of course now we have the bone marrow transplant, which is cure. But you see, the scale of our possibility is still limited because of lack of funding. Sickle cell disorder is actually an expensive disorder to manage. And in as much as this is amongst the top 8 causes of child mortality in the country, and amongst the top 10, non-communicable diseases, from the government angle, there's been little or, a strategic or direct effort towards driving national, all-inclusive, assistance or intervention, when it comes to sickle cell disorder. I feel that it's not still at the front burner of conversation, and it's not still looked upon as a major priority. But sickle cell disorder is a national health emergency, and we can do more than what we're doing right now. We have policies, but how far are we implementing policies? And private sector players cannot cover the country. We need heavy government intervention and involvement to actually do more for our people.
And I hear you on funding and also on, not being on the front burner, because sometimes for those who have a relationship with sickle cell survivors, you realize that it takes a lot of money, especially when you want to stay healthy and stay alive, sometimes in millions of naira. And so I'm wondering, how do we get that conversation on the front burner?
It has to be an advocacy effort, and we have to start working as a community, as a collective, not as individuals and in silos. So we want the federal government, we want the National Assembly, the Ministry of Health. Let's come to the table. As a matter of fact, in this country right now, persons living with this condition don't even have access to health insurance, as basic as that is, because it's an unpredictable medical condition. So can we even pass laws and bills that enable these people afford, easy and equitable access to quality care and affordable care? And this is something that can be done from the legislative. And if our government can actually push this narrative forward, private sector, private health sector would actually, follow and take, cue, and there'll be proper precedence from the government. So let's start with having conversations on reducing the cost of, routine medication like hydroxyurea. They need these things to live. But many of them live below the poverty line. They can't even feed. They can't clothe themselves. They can't house themselves. And to spend over 40,000 naira on routine medication in a month, what's the minimum wage in this country? So the government, we need to come together and sit down and actually implement policy, not just make policy that will reduce the cost, involve these people into health insurance programs, and then drive more sensitization programs, prevention, to reduce, the prevalence and incidence rate of this condition, because Nigeria is the sickle cell capital of the world. We have the highest burden globally, and there's so much that we can do to actually change this narrative.
So 2 issues. One, how do we reduce that burden? And number 2, we've also seen people who, sickle cell survivors who families have loved them till the end, but there are those who basically are just relegated to the background. How do we also ensure that they are not stigmatized?
we have to change our social perspective, and that has to do with intentional, consistent orientation, reorientation. You know, we're coming from a very cultural, religious construct, the way we interpret medical condition. And we've been looking at these people as Obanje, rejects, Abikun, and this is basically a blood disorder, not their fault, genetically transferred to these people. As a nation, as individuals, we have to take it upon ourselves to change our lenses. If we start to look and look at them from the place of love, empathy, and consideration, and then intensify efforts to inform the next generation, the young people that are within their reproductive age, to actually know better and make informed decisions, like knowing your genotype and having constructive conversations before you go into marriage or relationships that will give birth to kids with this condition, considering the little or no access to proper care. Then we can actually scale down the burden and change the narrative by informing people that this is not a death sentence. We have people in the foundation that are living up to 75 and living well. That means if they can actually afford to, procure their routine medication, eat properly, have the best living conditions, they can live and thrive and, excel like every one of us. It's possible to live long with sickle cell disorder, but how many people know this? Well, it takes a lot of investment, and as a collective, we can help our people, win, this battle that's actually, bringing a stampede to their lives and their daily life.
Absolutely, it's a lot of funding, and that's why we're hoping that the government steps in. And the last one, I also like the point you made, it is not their fault. No one has to be born that way. It's the reason we should love them unconditionally. Thank you so much for your time. Our Program Director, Sickle Cell Foundation, Nigeria, Caleb Audu.